Assalamu alaikum, APPNA members. Welcome to episode 3 of the APPNA Cafe series. This is Dr. Sophia Janjua with the APPNA Communication Committee. And this year our cafe series is going to highlight the specialty societies of APPNA. In the previous month, we had highlighted APCNA and the work that is being done by APCNA. And as March is Colon Cancer Awareness Month, we decided to highlight the work done by the APGNA, Association of Pakistani-descent Gastroenterologists in North America. To represent APGNA, we have Dr. Asad Rahman. He is the president of APGNA, and we'll be talking about what APGNA does and how it has helped make an impact in communities over here in the US as well as in Pakistan. A little bit about Dr. Asad Rahman. He is a graduate of Khyber Medical College, I think class of 2010. He was in fact the best graduate of his class. He did residency in Orlando, where he was also serving as chief resident, and did fellowship at the Cleveland Clinic in Florida. He is currently working as the Associate Program Director of the GI Fellowship Program at the Cleveland Clinic in Florida, is also the Internal Medicine Residency Program, part of the core faculty. Welcome, Dr. Asad Rahman. Thank you for giving your time and sharing your journey with APPNA Cafe today. So I'd like to first of all ask you about how did you get interested in GI, and tell us a little bit about your journey from Khyber to Florida.
Thank you, Dr. Janjua, for having me. I think it's a very nice series that APPNA has started. I think so. A little bit about myself. I was born in Lahore. My parents are from KP, so Pathan. So I went to medical college at Khyber, and with a completely open mind. My father and mother were not in the medical field, but I had some extended relatives. So Alhamdulillah, I did well in medical school, and I wasn't sure if I was ever going to come to the US. Most of our teachers over there had trained in the UK, but a few seniors had gone to the US, and they kind of paved the path that I ultimately took. I did my house job in Pakistan, and at that time in internal medicine, we didn't have much exposure to gastroenterology, but I knew that I wanted to pursue internal medicine. And before I came to the US for residency, I also did a year of FCPS training in Jinnah Hospital in Lahore. And the medical unit 2 was the designated GI unit at that time, back in 2012, 2013. So that gave me, the first experience about endoscopy and, GI care, so to speak. And that really fascinated me in terms of the acuity of patients that would come in with GI bleeding, and how life-saving and endoscopy could be in those situations. A lot of people who had decompensated liver cirrhosis as well. So I think that got me interested. And when I came to the US and did some rotations, although I didn't rotate in GI, I still saw the impact that gastroenterology had, in the care of patients who are on the medical floors. So I think that's what, interested me. As I, started my residency, I gravitated more towards GI, as I did some rotations in the earlier part of my residency. And that's ultimately, the way that I got interested. I was in a community program, but I was lucky to have mentors within my institute to help me, do some research. And that probably is very, very important in terms of my experience and subsequent path, because that's what taught me the value of mentorship moving forward. And I was lucky to, go into fellowship and subsequently be involved in mentorship for residents and our fellows that I work with every day. So that's a little bit about myself. I still consider myself an internal medicine doctor at heart, and that's why in GI, I take care of patients with complex inflammatory bowel diseases. I'm the medical director of the IBD Center. So I think that's a little bit about myself and my journey so far.
Thank you very much. It's very interesting. I find it I'm a gastroenterologist as well, and so I always find it why GI, right? People go into cardiology and neurology. So I think the GI field is very specific, gives you a little bit of internal medicine, it gives you a little bit of surgery, and so it's very interesting. So you said that you are you run the Inflammatory Bowel Disease Center
Yes.
in Cleveland, Florida.
Mm.
So, what interested you about the inflammatory bowel disease? Because that's a subspecialty, so to speak, of GI.
So I think as IBD, I mean, the care has evolved so much. I think when I began my fellowship in 2017 and I completed in 2020, I think that was the time when, almost every few months a new medication was coming in and our understanding of IBD was evolving. And I still considered, internal medicine to be a very, very strong part of my career. So I felt like that really is a very cerebral specialty in gastroenterology. I love to do endoscopy as well, but still, I think it was something that made me very interested. So the care of these patients is very multifaceted. You take care of these patients longitudinally. And then, as part of the Cleveland Clinic enterprise, I was lucky to have some rotations at the main campus and then did a visiting fellowship at the Northwestern University with Steve Hanauer. So I think that was very pivotal in terms of of getting more and more interest in how the care of patients with IBD is evolving. And I believe, I think in terms of the medical aspect of things in the entire GI space, I think it's still probably in terms of research, it's the leading
It
portion of
is.
gastroenterology. Again, we
Yeah.
are making more advances in advanced endoscopy and third space, and complex resections and everything. I think that's another very interesting facet of GI as well. But I think in terms of the medical care of patients, I think the IBD space has really evolved a lot in the last 10 years.
That's true. So coming from, Lahore to USA to Florida, then how did you get involved with APGNA, the Association of Pakistani Gastroenterologists in North America? So it's still a young organization. I learned about it very recently, although I've been involved with APPNA for so long. And so I think it's commendable, and I would like for you to tell us a little bit about how you became involved with APGNA and then tell us a little bit about APGNA as well.
So, it started with the WhatsApp group. I can tell you that. And I think I joined that WhatsApp group right out of my fellowship. I think in COVID times, that was our medium of communication. So I don't exactly remember how I got the WhatsApp invite, but once I was in there, I realized that it's a very nice community. It had a very nice feeling of belonging in a very rather competitive space. I felt like, you can communicate freely with people of similar backgrounds and share the challenges that you face. I was a new attending at that time, right out of fellowship. So I think it helped me significantly in terms of connecting with people who I had, communicated with earlier during my residency and during my fellowships. And it was, a very, very nice way to also connect with people of similar backgrounds. And then Anis Bhai reached out to me a few years ago when they were looking for a varied background of people who were going to be in leadership in APGNA. So at that time I got involved as a treasurer and subsequently have been involved with APGNA in the executive committee over the last 3 years. I think APGNA is a community. It's an organization of people who are, of course, have roots in Pakistan, and it has varied members. We have trainee memberships for fellows who are currently in training, and we also have the regular full memberships for people who are out of their training so far. Our members have a lot of varied interests. There are people who are in private practice, people who are in very, very strong academic positions. Our members have leadership positions within the ACG. I mean, several of them are governors of ACG or have been served as governor, and they're also part of the ACG board of trustees as well. So I think it's a very multifaceted group. It has a lot of different facets to it, and we can talk about this in detail. But I think it allows a sense of belonging to a lot of upcoming gastroenterologists in North America.
That is true. I also found when I joined it that the WhatsApp group is a very dynamic group of individuals. There's a lot of articles that are being shared, the current guidelines, what are the guidelines for what is the role of the prep, and also I think it keeps us very current as well. And if anybody has a question, I think people respond to it very nicely. So I've also enjoyed being part of that group. So a little bit about APGNA. I think it was I think formed in 2014. Is that correct? I mean,
That's
give us
correct.
a little bit about the Association of Pakistani Gastroenterologists North America, and how many members do we have, and what exactly. It was relatively young, and I think you guys, the APGNA does conduct meetings also at the time of the summer meetings. So share a little bit more about APGNA.
Yeah, so as you mentioned, it's probably been 12 years or close to 12 years since its inception in one of the APPNA main summer meetings that it was actually founded. And over the years, it has accumulated members. I mean, we have about 125 members currently, and a lot of trainee members, and a lot of interest in actually residents who wish to become GI fellows and subsequently gastroenterologists. As we mentioned, most recently, I can give you an example of our meeting at the ACG meeting in Phoenix, Arizona, where we actually met in an evening, and we invited the leadership from the ACG, the American College of Gastroenterology, where the president came in as well and gave his remarks about our organization. I think that meeting served as a very nice, cohort of actually gastroenterologists from all different walks of practice in the US. So in terms of its impact or its CME sessions, it regularly conducts it's the CME sessions in the APPNA main meeting last year as well in Dallas. So as you mentioned, the APGNA was founded close to 12 years ago in one of the APPNA annual meetings, and so over the last 12 years, it has accumulated full-time members who are practicing gastroenterologists. We have about 125 GI doctors who are full-time members, and we have an ever-rising trainee membership as well for our fellows who are currently in training, and that membership is not is free. So essentially, the APGNA organization has with the increasing numbers, we've had an increase in impact both within the US as well as back in Pakistan. In terms of the ACG or the involvement with various organizations, it has a greater association with ACG, or the American College of Gastroenterology, where several of our members serve as governors of different chapters of ACG. So at the most recent annual ACG meeting in Phoenix, Arizona, there was a dedicated room for the APGNA meeting, where we had the ACG leadership also invited, and they acknowledged the impact of APGNA members within the ACG itself, as well as the contribution that APGNA makes, back in Pakistan, both in terms of patient care as well as education and research. So I'm very happy to share that we've had this organization acknowledged by the major GI society in the United States. In terms of the involvement with APPNA, again. In I think the annual summer meeting, APGNA does organize CME sessions, and as well about very important topics that are relevant to the main APPNA members. So I think last year as well there was a CME session, and we plan to do the same in 2026 as well in Orlando.
Very good. Thank you. And then in terms of, so I think apart from CME and education, I think it's very encouraging to hear that ACG, the American College of Gastroenterology, the APGNA physicians work closely with the ACG. So I think that's important to carry an impact in communities over here as well, and make sure that we continue to do that, because that will impact not only how we care for our patients, but health policies as well. So in terms of in Pakistan, right? I mean, I kind of read that there is a lot of work that APGNA physicians are carrying out in Pakistan as well. So would you like to share some of that with us for the APNA membership?
Yes, certainly. I think there are certain formal partnerships that APGNA has with hospitals like Indus, which has hospital in Lahore as well as in Karachi. where there has been a formal exchange of our gastroenterologists who are practicing here in the United States, and they go to Pakistan and they actually help with the didactic education of various trainees in those hospitals. They have certainly helped in in advancing the endoscopic and the advancement in Pakistan, where they have set up EUS equipment and trained different gastroenterologists about how to perform diagnostic and therapeutic EUS in Pakistan. Dr. Faisal Jaffrey is leading that initiative, which is very, very impressive. Similarly, we do some volunteer work where our practicing gastroenterologists in America, we donate the equipment from here, and it's taken over to Pakistan, and then it is helped. There are various equipments that basically are transferred over there. These come from PEC tubes they can use. They have been able to go and use stents over there from the United States, and certainly those things for deserving patients can actually help impact the communities over there. Again, we have practicing GIs here who also spend part of the time in Pakistan and various institutes, and that also serves as a very nice bridge for
nice.
patient care back in Pakistan, and also serve as a soft image here in the United States as well.
Oh, very nice. So the physicians over here collect stents or PEG tubes and then donate it or take it with them whenever they go to Pakistan.
Exactly,
So it's
yes.
done in a very good. So that's very encouraging. And so as the membership continues to grow, about APGNA membership continues to grow, I see various people come on various platforms to create awareness. So that's great. One of the reasons, we decided to do this talk in March is because March, as you are aware, is Colon Cancer Awareness Month. And colon cancer is the second most leading cause of cancer, continues to be the second most leading cause of cancer deaths. And then we are seeing data that we are seeing colon cancer involve among a younger population, right? And so, in terms of awareness, what do our APGNA does in terms of awareness, not only among the U.S. community, but also among Pakistani community. I have read that the South Asian community doesn't get themselves checked as frequently. So what can we do, as physicians and as gastroenterologists to increase awareness among the community? And what would you be able to tell us about how we can prevent it from happening?
I think that's a very important point that you brought forward here. I mean, in the US, as you mentioned, it has probably impacted a lot of younger adults even today. I think I saw the news of one of the of an actor who actually passed away from colon cancer below the age of 50. So certainly, colon cancer, in terms of its impact both in morbidity and mortality, has actually worsened in terms of the younger population, where other kinds of cancers have actually plateaued or declined. So it's certainly a cause for concern, and several members of our APGNA, I mean, they're doing landmark work in colorectal cancer screening and prevention. Dr. Shaukat in NYU has done a tremendous amount of work, and she's leading a lot of initiatives for colon cancer screening and prevention. Members of our APGNA have done colon cancer awareness walks as part of APPNA local chapters, like in Oklahoma. So it's a very regular event, and it certainly helps educate the local community about appropriate colon cancer screening. And it's a whole different ball game, however, when things come to Pakistan. I think
Yes.
because of the epidemiology of colon cancer, but also a significant part of it is also lack of awareness of how colon cancer can be prevented. And screening certainly is important. So I think I really appreciate the initiative that APPNA is taking in terms of colon cancer prevention, and creating some reels that you had mentioned about how to educate the masses about colon cancer screening in Pakistan. I think charity begins at home. I had to speak to my parents as well a few years ago
Yes.
when I became a GI fellow. And I think it's all about, education and, giving people options. I mean, no one size fits all. So I can tell you that, my father had a colonoscopy, my mom had a stool-based test. So again, at least they got screened. I think it was a
They
very
got
good.
checked.
So just
Yes,
wanted to share
that's
that
very
with
true.
everybody. But at least
Yeah.
that's something that all of us who have family back home, that we should educate them, give them, appropriate education, and of course, leave the decision to them. But I think it's very important that we, as in the current social media age, that we utilize, our energies, and also, with this appropriate March being the colon cancers awareness month, also, educate our families back home, but also utilize social media platforms to educate, communities at large.
Guys, that's very true. I found that social media, people tend to listen to social media or get the news on social media before they get it anywhere else. And that's true. I think we can do a lot more to create awareness among the South Asian population, particularly Pakistan. I think Dr. Shaukat was instrumental in dropping the age. For screening age used to be age 50 and now it's age 45. And anybody with family history should be checked earlier than that. So that's true. And so I wanted to know, in terms of, if you had to tell us about what are the top five things that you would recommend as a gastroenterologist, as an internist, as an IBD. What are the top five things you would tell your patient to say that what you can do for better colon health?
So I think, in terms of is it pertinent to just in the United States, or back in Pakistan as
Well,
well?
you can make it both. You can
I
say
think,
in the
yeah.
US and in Pakistan, you can make it both. I think in Pakistan, it's also a cultural aspect. I found it even, I talk to people, they get really embarrassed, about
Yes.
talking about a colonoscopy. It's a cultural thing as well over there. But let's start off with
Yeah.
with US and then.
I think, yeah, I think in terms of colon health, I think I start with the adage called, "We are what we eat." So I think it's very important that we put, we make healthy choices in our diet, and I think that has a lot to do. It's not just, what we, in terms of our gut health, but I think overall health is it's very much important. I think in the current age where we have so much, preservatives and things that are processed, it has a lot of impact on our microbiome and the way that plays a role in our overall health, and not just gut health. But I think try to avoid processed foods. That's number one. Number two, I think it's important for us to know in terms of gut health is, many times, especially for the Pakistani population, where every viral infection gets treated with antibiotics, to try to avoid unnecessary use of, medications that can affect our gut microbiome. It has a role in the, different pathophysiology of different illnesses. So I think, and it also increases the risk of, resistant organisms to develop. So I think it's very important to avoid injudicious use of antibiotics. It may affect our gut health as well. The third thing is that there's a lot of social media things about, or a lot of coverage for supplements. I mean, unfortunately, we don't know a lot about them because they don't undergo the type of studies and the type of, different ads, focusing on probiotics, prebiotics. But I think a healthy diet is very important. Unfortunately, we don't have any data on any particular probiotic or prebiotic helping gut health. The only thing which I think is good in our South Asian diet is maybe there is some anti-inflammatory effect in turmeric or curcumin, and there is some small studies that show its effect in mild to moderate ulcerative colitis. So I think it has a role, but again, it tells us that probably, don't overdo the supplements, and I think that's something that can have an impact on your gut. But also, I mean, these are not cheap either. That's something
Yeah.
important to know. The other thing is, very important that we don't consider colonoscopy a taboo. As you mentioned, colon health is important, and we need to do whatever, we do in terms of, preventing colon cancer. As you mentioned, it's the second leading cause of cancer death in the United States. And apart from screening tests like mammography and pap smears and other things where cancer is detected, colonoscopy actually, not just detects colon cancer, it actually detects precancerous lesions that can actually prevent colon cancer.
Okay.
So that actually
That's
is
right.
something that is not just a diagnostic test, it's also a therapeutic test. So I think it's something that people don't look at when they're choosing the type of colon cancer screening that they're looking at. And lastly, I think, in terms of, I think physicians as well, and also everybody else, I think we need to educate everybody about options, or empowering ourselves in terms of the choices that we have in healthcare, whether that be in GI or outside of GI. I know that we as gastroenterologists are biased towards doing colonoscopies, but I think we must understand the environmental impact that doing endoscopic procedures bring. So I think individualization of care is important, and we must look at the patient in front of us and give them the options and empower them with everything that they need to know in order to make a choice. Like I mentioned, my both my parents took different routes, but at least they got screened. So I think some screening is better than no screening.
Yeah, absolutely. And I think when people think of wellness, when we say wellness, we think of mind and body and work-life balance. But colonoscopy is considered a wellness exam as well, because as you said, not only does it detect it, it's diagnostic and therapeutic. It can take out colon polyps. So it's part of the wellness check that we kind of make that part of the exam as well. So I think that's important for people to, for most people, especially the South Asian community, to know as well. So in all, it's basically diet, avoid too much antibiotics, supplements, which I 100% agree with. I see so many supplements, my patients take it as well. And then colonoscopy and individualized care. That's very true. Thank you. And that's our take for what we can do for Colon Cancer Awareness Month. So, anything else, Dr. Rahman, you would like to share with us that you would like for the APNA membership to know? Uh,
I think that apart from colon cancer screening, which I think is so very pertinent, I think regardless of, I think it's important to be screened in the United States. People between 45 and 75 should be screened for colon cancer. I mean, barring any comorbidities that they may have that may significantly reduce their life expectancy. I do want to also share, in terms of inflammatory bowel disease, I feel like that is also an area when I was in medical school and also doing my initial house job and initial training in FCPS training over there, I found that IBD patients were seen in the surgical wards. I mean, that was a surgical diagnosis because of lack of, medical therapeutics that were available. But I think the epidemiology of IBD is changing a lot. Unfortunately, for reasons that are likely related to our lifestyle choices that we make and the westernized, diets and our sedentary lifestyles and lack of exercise and probably the type of foods that are being introduced that were never given prior, there has been a significant increase in the incidence of IBD in the eastern population, and that has been demonstrated in large-scale epidemiologic studies in India. Although we don't have that kind of data still available from Pakistan, but one can extrapolate because we are rather similar in our genetic makeup. So I also want to tell our people that those immune mediated diseases, IBD included, we do have the genetic tendency to develop them. But I think our environmental influences, especially in early life, help us in terms of, for the majority of the people to not develop that. But as our lifestyles have changed, our diets have changed, unfortunately, we are unmasking a lot of those, genetic tendencies. And that is, that the phenotypes do get expressed. So I think something for the people to know about and that goes with the first point that we made was about choices in lifestyle and diet. So try your best to avoid unnecessary antibiotics. Try your best to avoid processed foods. There is upcoming data on emulsified foods that are used quite a lot, and the fast foods that we do consume. So I think try to avoid that, and just being and getting brought up in Pakistan does not protect you from those immune mediated diseases. So
right.
be cognizant of that, and I think we should be sending the same message to all of our families who are still back in Pakistan.
Yes, absolutely, absolutely. And I think I read somewhere about vitamin D levels. Vitamin D levels can also, if you have adequate or adequate amounts of vitamin D, that can be a protective factor as well towards gut health. Is that correct? Is that what your observation has been as well?
Vitamin D has, I mean, I think it comes in waves, like studies that linked at aspirin, for example. We see that all the time. Sometimes the pendulum swings towards using too much of it, and sometimes the pendulum swings in the
Right.
direction where things are more in the realm of association and not causation. I think vitamin D has a lot of immunoregulatory properties. Unfortunately, even though I am living in Florida, a lot of people in Florida have low vitamin D levels. So
Yes.
but still, I think it's something that I do check for my patients with IBD once a year or so, and if they're very deficient, we should be replacing that. So certainly that, as well as other factors as well, play a role in terms of our defense or a modulation, so to speak, of our immune responses. So I think it's very important that we eat healthy, go outdoors, exercise, and do all that to actually keep
To
ourselves
have a,
healthy.
yeah,
Yes.
that's very true. Well, thank you very much, Dr. Rahman. It's been very informative. This is very educational in terms of what people can do for their gut health, what learn about inflammatory bowel disease, how it is affecting the South Asian population as well, and often being undiagnosed or going to other places or other specialities before being seen appropriately. And eating healthy, avoiding too much antibiotic use, getting a colonoscopy. These are all important things. And then the most importantly, the work that you volunteer for, apart from working as a gastroenterologist in your community, but also volunteering for the APGNA and mentoring younger physicians and allowing them to volunteer here and in Pakistan. This is very impactful work. We thank you for your time. APPNA members, we thank you. We hope this has been an informative session for you, and we look forward to the next episode in April. So thank you all very much. Thank you. This is APPNA Cafe. Thank you.